A tale of two cities, two regional epicentres of the coronavirus, and two reporters sharing their experiences whilst covering the pandemic for CGTN. Zhao Yunfei was CGTN's correspondent based in Wuhan. He was there from the very start of the outbreak and the lockdown that followed.
I think Wuhan is the first city that was put into lockdown in the world. So back then, when I recall that moment, because I was reporting on the day when the city announced its lockdown, I was surprised by the fact that I didn't worried. I didn't feel I was not scared about what's going on because I really didn't know how long that will last.
Yunfen then showed me some of his reports from the height of the epidemic in Wuhan.
Tonight, Wang came to Hu's office. They want to call their 9-year-old boy to say Happy New Year.
Given the fact that Hu Ming and Wang Jie, both of them didn't get a chance to see their son for a month. I think the following 2 months they also didn't get a chance to see him. Even when they finish their work, they have to put themselves under quarantine for like 14 to 21 days.
The doctor that you were speaking to was talking about how he was head of the ICU, but they were having to get doctors in who weren't special. They never worked in an intensive care unit before. It was, look, if you're a doctor, we need you in this hospital, and it was kind of they were learning on the job. And that's something that we found. We went to this field hospital, the EFEMA field hospital in Madrid, which was set up kind of at the last minute to cope with the sort of buckling health system here. And we interviewed, when it first opened, we interviewed doctors there. Like we interviewed an oncologist who said, I'd never worked in an ICU before, and I was using drugs that I've never used before. And it's extraordinary how the doctors and nurses, not just in Wuhan, not just in Madrid, but all over the world have stepped up. And it's, you've seen the applause for the healthcare workers around the world now, and you kind of take it for granted now, but these people are amazing that they've put themselves on the front line. You meet the local residents here, and again, like the healthcare professionals, you can't help but be impressed by the way they've handled it all, the way they've adapted, and I'm sure the same is for you as well, the people, the real stories that you would have experienced in Wuhan.
Absolutely. Another point I would like to make is that given the fact that this is a very strict lockdown in Wuhan, in China, people has made huge sacrifices to help the general public to contain the virus, especially for those families that lost their loved ones during the pandemic. I talked with one of the family who lost their loved grandmother or mother. I asked her at the end, because I want to turn this to something positive. I asked her, what do you learn from this epidemic? Is there anything that you can, I know this is a tragedy for your family, but anything you could learn from it? And she said that, try to love the family more.
Pathak, CGTN, Madrid.